everyone, and welcome to this special National MS Education and Awareness Month conference hosted by MS Focus, the Multiple Sclerosis Foundation, made possible with support from Genentech, Bristol Myers Squibb, Sanofi Genzyme, Biogen, EMD Serono, Novartis, and Viatris. This presentation has additional support from Ocrevus. I'm your host, Deborah Foreman, Educational Programs Coordinator for MS Focus, and I'm joined by Lara Stepleman, PhD, who will be talking to us about dealing with depression. After the presentation, we'll open it up to your questions and comments. Now I'm delighted to introduce our speaker. Lara Stepleman, PhD, is the Chief of Psychology in the Department of Psychiatry and Health Behavior at the Medical College of Georgia at Augusta University. She is a health psychologist who has focused her clinical work, teaching, and research on assisting others to live well with chronic illness, particularly HIV and multiple sclerosis. She is especially interested in access to competent medical health care for individuals living with chronic illness who may have additional barriers to care and health disparities related to sexual orientation and gender identity, as well as race and ethnicity. She has collaborated with the Multiple Sclerosis Foundation since 2005. Now I'm delighted and pleased to have her join us to present this important topic. Dr. Stepleman, thank you so much for being with us, and I'll turn it over to you.
Great. Did my slideshow go up?
Let's see.
Nope, not seeing your slides
Look,
yet.
I worked so hard. Now I got to end my show and start over because I lost you guys. There you are. All right. See, I worked so hard to have it working and then it didn't.
You did.
I know. So let's try again. All right. And from beginning and swap presenter view. All right. Are we good? Okay.
Yes.
Sorry about that. I told them I mess up every time and I do. All right. Well, it is great to be with you all today to talk about a really important topic to me as a longtime mental health provider and as somebody working with the MS population and seeing and experiencing alongside them and their families the many struggles that having MS can bring. And so today, now I'm so, there we go. Today, I want us to be able to talk about several different things. So I want to talk a little bit about the different pathways and consequences of depression and MS, because there's more than one way that depression comes to us. I want to discuss some treatment options, but then also focus a lot on the strategies for coping and for living a meaningful life. I think really the bottom line is depression is something that can affect all of us, you know, especially in this very difficult time period that we are going through together on top of chronic illness and other life things, and that really trying to work towards having a meaningful life and finding joy, sometimes even alongside your depression, not instead of your depression, but with your depression, is possible when you learn effective strategies for coping. So one of the reasons that we're talking about depression and MS is simply that, like, the risk factor, the likelihood of having it is much higher than in the general population. So you can see here, lifetime prevalence can be as high as 60% of people who have MS. And I know you had a program already related to suicidality, and so you already may know this, but it is 7.5 times higher suicidality attempted and completed than in the general population. And so this interferes with a variety of things, including medical adherence, relationships, well-being, you know, families. And so the fact that this is so prevalent MS means this is something we must not just talk about once, but talk about again and again, and make sure that people are aware of how to talk to their providers about it, to their families about it, how to get themselves screened and treated for it well. So these are the clinical symptoms of depression. And so you can kind of go through them yourself, whether you have MS or you're a caregiver or just an interested party. You can see here that the symptoms include things like changes in sleep and feeling sort of like emotional out of nowhere. It could be tears, it could be anger. You may have thoughts of death or suicide, uh, feelings of despair and sadness, loss of interest in enjoyable activities, extreme tiredness or lack of energy, changes in appetite, as well as trouble focusing and concentrating. So, so anyone have a sense of why I circled the two in yellow? We can have audience participation. Do those look familiar? Did I mute? Can you all hear me?
We can hear
Yes.
we can hear you now.
Yeah,
Oh, could you not hear me at the beginning?
I did. We did.
Okay.
Yeah, just happened like 2 seconds ago.
Okay. So yeah, so hopefully you guys will warm up and join in and participate as we go. But the reason the ones are circled in yellow is because those are some of the most common symptoms of MS also. And that can make discriminating between depression and MS sometimes very difficult. And people will often come to their providers thinking that they're having a flare up of MS because they see this happening. And in fact, it really is the onset of starting depression. And so if you are experiencing things that look like MS, but are also noticing a couple of these other things, it's really important that you talk to your provider so that they can help you differentiate what's going on, because we have very, very good treatments for depression. And so if we know that's what's going on, we can take care of that. And the anxiety it causes people when they feel like it might be a flare up of their MS is pretty significant. And so we want to make sure that we all understand what's going on in our bodies and and not to make our own assumptions. So I don't know about you. I can sometimes be a Google diagnosis person. I don't know if all of you have done some Google diagnosis in your life. But so it's really important when you have things that have overlapping symptoms, and it could be one or the other, or other things as well, that you're able to talk with someone to help you make that differentiation. So why do people with MS have depression? So that's not really a simple answer. You may have your own answers to this when thinking about it, but there are a variety of reasons that come from sort of what we would call like biological, psychological, and sociological places. So depression can be a result of chronic stress over time related to the psychological impact of having MS. So MS brings with it a world of changes, especially for newly diagnosed people, and the stressors related to changes in functioning or changes in jobs or relationships. And that chronic stress has an impact on our bodies and our psyche over time, and that can contribute to depression. So that's one way, but there's not only one way. Depression can actually be caused by MS. So there's literature to support that MS actually destroys the insulating myelin that surrounds the nerves that transmit signals affecting mood. So there's actually changes in your brain neurologically, as you know, with MS. And one of those things, and because those things can cause inflammation, and depression and inflammation are highly correlated. And as you may know with autoimmune diseases, inflammation throughout the body is not uncommon and is one of the reasons that both depression and cognitive impairment can be seen in MS. And depression is also a side effect of some of the drugs used to treat MS, like steroids or interferons. It depends on the interferon, but there are certainly medications that can contribute. Even things like pain medications that make it hard to get motivated can contribute to things symptoms that may be depression or feel like depression. So you already start to see like both the things you're experiencing having MS can contribute. Also, what's going on in your brain from MS can contribute. The medications can contribute. But let's not forget, and I know you may hear this over and over from doctors, I certainly do, that not everything is about MS, meaning that you can have depression that has nothing to do with MS. You could have a family history of depression. You could be struggling from substance abuse problems, other non-MS life changes like other grief in your life. COVID, for example, has caused depression in a lot of people, which are none of these things up front. And so sometimes depression is independent, sometimes it's directly related to MS, and sometimes it's a combination. We may not always be able to determine all of those things, but what I think the most important thing to know is that if you're experiencing symptoms of depression, that this is something that is occurring and that you have multiple places that you could be having this from, and that this is not your fault, because people are like, I should have done something differently. This is not your fault. You're fighting biological changes, you're fighting medications you need for your MS, you're dealing with the chronic stressors. If you're feeling depression, this is not your fault. It needs addressing, but it's not your fault. I also want to remind people out there that depression in MS care partners is also significantly higher than in the general population. I don't know if we have care partners out there, but if we do, I think it's important to say that care partners, especially family members, are at higher risk than the general population. And this has to do with the fact that when one person's life in a family changes, another person's life in a family changes, you know? And so this is not experienced independently within a family. You know, if you're the parent, your children experience it. If you're sort of sandwiched between your own parents and your parents experience those changes, siblings, friends. And so the changes in roles, the emotional and financial stress, and the loss that they're experiencing, because just like when someone's diagnosed with MS, they worry about how much of what I had planned for my life will I be able to carry out. The care partners experience that too, of what's going to happen with my life. With I love this person, but what is both of our lives going to look like together? And so we really need to be mindful that our family members and care partners are at risk as well. And as many as 30 to 50% may experience depression at some point in their loved one's illness. Again, this is not your fault. This is about that there are some changes in our lives that are of the magnitude together where we may both experience those kinds of emotional distressors, sometimes at different times, and for different reasons. The losses that we perceive, some people will perceive a physical loss differently than the loss of a job or changes in financial or have physical intimacy changes. And so the things that may be contributing to depression for each person may be different. And that's why the good communication is so important through all of this. And so I don't know why this is duplicated, but we'll just skip that. Oh, I know why. I was like, why did I put that slide twice? Hold on, look at me. I told them I was terrible at this because I'm going to lead you through each one. That's why it's twice. It's like, why is that slide there again? Because I want to walk you through a little bit about each of the main ones related to MS to give you a little additional context. All right. So depression as a result of stress and MS. So yes, so we want to help you reduce stress, which we'll talk about later. So MS, I didn't realize it could be stressful, did you? Look at all these reasons that MS could potentially cause stress. So whether it's the diagnostic part or how unpredictable it is, a lot of my patients talk to me about how hard it is sometimes to have invisible symptoms because For them, it's a constant stress of having to sort of verbalize what their limitations are. So sometimes they're almost envious of people where their physical limitations are visible, because then they don't have to constantly explain why they can't walk to the other end of the shopping mall with them. And so the invisibility, or people not believing them because they can't see the symptoms as well. Also, having to adjust and readjust to changes. So MS is one of those disease states where we are one day may not be where we are 6 months from now. And sometimes it's better and sometimes it's worse, or sometimes it's just different. And so one of the things we know about brains, and this is why it's related both to kind of psychological and physiological stress, is that brains like predictability. Our brains love predictability. They love to know when we're going to eat. They love to know when we're going to sleep, what we're going to do. They like a predictable schedule. And everything about MS, especially when you're having a relapse, throws predictability out the window. Brains like predictability. A little change in novelty, like going on a trip to Europe and seeing new things, our brains like that. But our brains don't like not knowing if we're going to be able to walk well that day, or if we're going to remember things we were able to remember a week ago better. Our brains don't like that so much. So that can cause stress. The financial stress and concerns about employment and what might happen. If you're starting to have cognitive impairment, but really the stress often is the anticipatory anxiety stress related to what kind of cognitive impairment, if I have it, will it become? How bad will it be? The loss of control over our bodies. So we go in as young people, often feeling like we can do anything. And as we all get older, we learn that that's not true, and start to lose some control over different things. But this often happens, as you know, MS tends to strike, particularly in midlife, when we still expect to have a little more control over our bodies than we do. And suddenly, the things we want our bodies to do, they don't do. I can tell you, so people who have heard me speak before, I don't have MS, but I have an autoimmune disorder, myasthenia gravis. And while I am well maintained at this point related to that, there was a time period where if the heat got too much, I couldn't brush my own hair, like, and had to act, I couldn't lift my arms. It has different impairments, but like not knowing if I can put on my own shirt in the morning, like, was really very difficult for me, or if I'd be able to get up the stairs that day, depending on how weak my body was. And just all the decisions you have to make about what the right disease modifying treatment is and whether it's working or not, and should you change. And so the point here is that if depression came about from this myriad of stressors, we shouldn't be surprised that this might happen. Again, just because it's understandable doesn't mean it shouldn't be treated, but it does mean that there are a lot of things that may be going on in your life that can really make it feel out of control. I sometimes talk about stress like a stress cup, and like we can only take so much before it overflows. And once you have MS, you have the stressor at the bottom of your cup that's kind of always there. And then you have all the other life stressors that keep adding to it. And it's, before you know it, it's real easy for the cup to overflow. And if you spend time in chronic overflow, that's going to cause depression. So these are all the different types of stressors, kind of the categories of the things. We talk both about acute stressors, which tend to be rapid onset of short duration. Those are more likely to cause anxiety short term. And then chronic stressors, these ongoing challenges, cause ongoing wear and tear of sort of our emotional wellness and our physical wellness. And those are the ones that we're really at risk for depression related to. And that's really why early on, if you even think about COVID, which is a sort of microcosm for dealing with something that changes everything, at the beginning, more people experienced anxiety when it was an acute stressor, right? When we didn't know what was happening and it was just starting, there was a lot of anxiety. As COVID has gone on over a year now, it's become a chronic stressor, and that started to result in more and more depression. So that's just sort of an example over a period of years how how it can switch from acute to chronic and from anxiety to depression. And these are some of the warning signs. And you can see that the stress warning signs affect every part of your body. And this is why I say stress is particularly damaging for depression, because it can cause depression via the emotional symptoms and the things that you may be more agitated and feel more overwhelmed and isolated, but also these physical symptoms that you may have, and the behavioral symptoms that you may do, like sleeping too much or too little, isolating yourself, using drugs and alcohol. All of those things can contribute to depression too, right? Because if you're not around your people and getting support, that's going to contribute. You know, if you're using chemicals to try to control your mood, that usually catches up with you, right? So, you know, some drinks in an evening might make you feel good, but the next day, and I know certainly for me, so I have the myasthenia gravis, but I also have a reactive arthritis. And if that's acting up and I drink, I can barely walk the next day. So, so we do ourselves damage when we engage in behaviors that aren't good for ourselves as a result of stress, and when we don't attend to these things going on. And so you can just kind of take a look at those to help you kind of think through sort of how you've responded to stress in your own life, and which of these you may be doing that may be impeding your ability to sort of experience better mood, that might be able to be changed over time as we talk about treatments. So depression as a result of the MS process. So we talked about briefly that MS impacts our body in several different ways that can increase depression. And so where your lesions are, if you have an MRI and they see lesions in certain places on your brain, that can contribute to depression. Not all lesions contribute to depression. They depend on where they are. Brain atrophy and shrinkage can contribute to depression symptoms in MS, which can happen. And then what I talked about earlier was this increase in inflammation. And anytime you hear the word inflammation in the body, just know I work in a couple of different diseases that cause inflammation in the body. And they both actually, like, so I work in HIV also, which is not an autoimmune disorder, but an immune disorder. And it also causes significant inflammation in the body, as does MS. And interestingly, the depression rates and cognitive impairment rates are pretty similar, which shows you that even though they're totally different disease processes, just the fact that they both cause pervasive inflammation in the body can result in the same brain changes in your body. And then again, we also have our medications. So we talked a lot about corticosteroids. I have patients who have come to me and told me whenever I have to go on steroids, my spouse calls that my like chronic PMS month, like that, you know, that I'm going to have this kind of moodiness and irritability that obviously when you're not on them dissipate, you know, it decreases significantly, but they almost have to plan for it because they know as a couple that the steroids really cause, and I've been on steroids before. I don't have as significant mood changes, but some people have very significant mood changes. And that the disease modifying therapists, don't you love when you catch your own typos? The disease modifying therapies and interferon specifically have shown increased depression in a small group of people in some studies. But let me be clear, the link is weak. So if you're having depression, the likelihood that it's one of these other things is much higher. So it seems that for a small group of people, this can be a link. But I also know that we've had a lot of people come to the doctor saying that they feel like it's their therapies that are likely contributing to the depression. And it could be, but if I go by statistics and frequency of where people's depression is coming from, that's probably actually one of the later ones. I'm probably going to look at other medications, other stressors, and other things going on in your body because all sorts of like pain can contribute to depression, lack of sleep can contribute to depression. So we really want to make sure we have a good understanding of those things. And so that's sort of building the case for like, yeah, there's depression in MS, but what are the consequences and what do we actually do about them? And so the consequences can be pretty significant. And that's why this is so important to me, because I really do see people who have profound effects on their life. It may make you not take the medication the way you should or not at all. It can make you more susceptible to other diseases because of its impact on the body. People who have depression often experience higher levels of pain, which, by the way, also will make you experience higher levels of depression. Pain and depression have this cycle where the more depressed you are, the worse you feel, the less you can do, the more your pain hurts, the more you hurt, the less you can do, the worse you feel, the more depressed you are. And so it can make your pain experience feel higher and your fatigue. Uh, People who are depressed may have more trouble having sexual intimacy with their loved one, and more withdrawal from people's support network that really help keep them going. We found again in COVID just how important those things are. They can make more mistakes at work because they're not concentrating well. And again, that's not probably MS cognitive impairment there. That's about feeling so down that it just makes it hard to stay concentrated, hard to do your work with efficiency. You may find yourself kind of doing things over and over again. And it may increase your risk of injury because people who are depressed often aren't paying as good attention to the things around them because they're kind of in their own head. And when you're in your own head a lot, you can burn yourself, you can trip and fall. And we know for people that are already having problems with ambulation, we don't want to increase their risk of injury. We want you to be safe and protected. And lots of other things. But the overall picture I'm trying to paint here is that it doesn't just affect one thing. It affects our people, our bodies, the things that we do or don't do or pursue in our lives. And that's good reason to get treated. And I recognize that some people may feel stigma if they've had depression or experienced it. Stigma being feeling like you don't want others to know, and self-blame, and what will people think of me and think I'm not strong. But this is a significant, serious medical illness. Even not talking about depression, or not talking about MS-related depression. Depression itself is one of the most costly health conditions in the world that we treat. We lose billions of dollars a year to untreated depression in the world. So this is not just sort of a thing because, you can't, you can't cope well, that you're not trying. This is a serious medical condition and needs to be treated that way. So one of the things that's really important is that you take time on occasion to assess your depression. And so this is one of the most commonly used depression instruments. One of the problems with this is there is a couple of ones related to concentration and feeling tired. And so I tend not to look at those as much. The two biggest predictors of depression is whether you've lost interest and pleasure in doing things. So that's one of them. And then the other is whether you're sort of feeling bad about yourself, like a failure. So it's these like emotional pieces and lack of interest in things that you like that really show, for people that have medical conditions, those tend to be more predictive of whether you're experiencing depression than whether you're having trouble sleeping. And so just kind of taking a look at this, and obviously suicidality as well. And so it's important, just like you get, medical tests, that you on occasion get depression tested. And by the way, there's lots of places online that you can do this for free. There's like mentalhealthtest.org and that have all kinds of good screenings out there for you to be able to do. We do these regularly with our patients and check them over time. Are folks, so you can just like raise hands. Are people getting assessments for depression in their clinics? I see a hand go up. I don't know that I can see all the hands. I saw a lot of people without hands, even of the people I could see. So that worries me. Thank you, Judy, for your raised hand that I. So I think reminding yourself a couple times a year, if your doctors aren't doing it, for you to take an assessment and keep track of your depression. You can, and I'll show you later in here, like a mood chart that you can use that would be just as good as doing a symptom check to kind of know whether you should talk to your doctor about it. But you shouldn't just count on relying on yourself without any data like this, because a lot of people, turns out, don't notice they're depressed. They're like, I'll be fine. I'm just having a bad day. And their family's like, you've been like a totally different person for the last month. What is going on? And sometimes when we're really depressed, we don't even see it in ourselves. And so that's why it's important to have other people give you feedback, to take assessments, to track your mood, because it can play tricks on your brain. And it's easy for us to sort of like, oh, it's just another bad day. It's just been a really hard week. It's been a really hard month. It'll get better. And really, by the time we address it, you already have a significantly more severe depression than had you caught it earlier. And so that's one of the things we really try to do, is that we know that the longer the depression goes untreated, the more likely you are to have more depression cycles and more severe depression cycles over time. The earlier it gets treated and the better your skills get, the more likely you are to knock it out or to not be as significantly impacted by it. And that's really why we don't want you to procrastinate if you start feeling that way. We want to be able to get in there and help you as early as possible to really mitigate what could happen to you. And so here's some from the research of formal assessment of depression and why it's needed. So even when your doctors are great doctors, still as many as 25% of MS patients have untreated or undiagnosed depression walking around, which is affecting your MS and affecting your life. And other research indicates that only about a third of patients with major depression or suicidal thoughts received related care. So we have a gap between people who are experiencing depression and suicidality in MS and who are getting treated. And that gap has to do with, on the medical side, us not always doing screening at the level we need to. I would have loved to have seen 100% of hands go up, that when you go in for your MS care at least once a year, they're giving you a depression screening. That would reduce this problem. But also sort of being responsible, just like we are. I mean, so, you know, I'm probably not the only person out there who occasionally goes through periods of not getting on the scale because you just don't want to know. You know, but this is not different than that, right? And so avoiding checking in really on your mood. There are days where I just like make myself get on the scale and say, I don't care, however bad it is. It's not like it's not that. It's just that I'm not looking at it. It's still that. Whatever that number is exists, whether I see the number or not, and I make myself get on. Similarly, it's really important that we say to ourselves, we have to be partners with the doctors. We have to make sure our doctors are checking it, and that in between, we have to do a good job of checking it so that we can catch this. And part of the reason we're missing it, as I said, is sort of a lack of screening, overlap between clinical symptoms of depression and MS, and what we prioritize. So these are sort of the physician reasons. And so when we see patients during MS medical visits, if you're an MS physician, you're a neurologist, you're focused on making sure people's MS are stabilized. Are they experiencing everything? Depression isn't always at the forefront, although a lot of doctors have gotten very good about this. We're still not all the way there. So having worked with a number of wonderful neurologists who do MS stuff, who have advocated for this. And multiple MS organizations have put out statements related to that. This should be part of standard care. This should be part of gold standard care that we assess for depression.
Dr. Stepleman, excuse
Yep.
me. We do have a question from Jacqueline, and would you like me to?
Yeah, please interrupt. That's fine.
Okay, so she had asked, she said that she had brain surgery in January. She's going to be starting radiation in April and chemo after that. She's told that a strong possibility that her MS might have a flare up from that. So she's starting to have anxiety over thinking about that. And what can she do to prevent this, if any?
So what I'm gonna so first of all, I'm really sorry that you're going through that. That I know that has to be a lot, going back to the stress as well as sort of all the physical things going on in your body. And I very much empathize with the level of anxiety you must be experiencing. So what I want to do is go, when we get to the treatment piece and the coping strategies piece, is to come back to you and focus on that, and try to point out some places where that might be particularly helpful. And then if there's other questions you have related to how you might cope and get ready for that, to please ask. So, because there's actually a number of things, and since I know they're in my presentation, I'd rather put a pin in that very, very important question and come back and circle back if it doesn't fully answer it.
Okay. We also have another, Deborah wants to know, what about feelings of resignation? And also, she wants to do stuff, but she can't physically. And she is screened regularly.
Good. Yay for screening. So feelings of resignation. So we would kind of call that like hopelessness, giving up. So that's strongly tied to depression, if that's specifically what you're asking. I'm hoping again that when we get to some of the coping things, we can talk about that. What was the second part of that?
Let's
The resignation.
she just wanted you to know that she's screened regularly, and she wants to do things, but she can't.
That was it. Yeah. The part of wanting to do things. So absolutely. So again, we will address some of that, but what I will say is that's built into the depression. So when I say loss contributes to depression, it can be not just loss of like bladder functioning or actual loss of a person, loss of anything that you've had prior to having MS, right? Again, it will contribute to depression, and then how you're going to figure yourself around that. Again, I use COVID because like we got to experience all of it in a year, so it's versus MS, which is much longer and drawn out. But if you think about the experience of that and so many things changing and so many losses that we had related to that, of things we couldn't do, and then sort of working towards creativity of saying, okay, maybe it's not that I can't do this, but I have to do it differently, or I have to do something like it, but not this, right? So, what we did over the course of this year is continue to generate additional ideas for ways to get our needs met. Because sometimes if I ask someone like what they can't do, and it's like, I can't, now I'm not going to be able to come up with an answer, but like, so if they say they can't run marathons anymore, we'll do that. And I'll say, well, what did you love about running marathons? Well, I loved being physically active. I loved feeling accomplished, of being able to do, work towards doing more and more. So what I try to do is find the underlying things that activity represented, and then say, okay, so you're someone that likes to set goals and try to move forward. You're someone that likes to do physical things. So let's talk about a different physical thing that would help you, that you could set goals and feel achievements and give yourselves rewards for, that might meet. It won't be exact. So we can't do exact, and part of acceptance is that it won't always be exact, but that we can, the things that we like to do come from underlying values that we have, of things that we enjoy and why we enjoy them. And if we go from what's the value and what's the need it's meeting, we can often come up with different ways of doing things or different things to do that meet those needs and values. I probably talk more about that in here in a minute too, but that I think is important because those losses really are tied to depression. And sometimes the depression keeps us trapped from being able to see what else there might be that might meet that need because we feel hopeless and we feel that resignation. And sometimes we just feel stubborn because, and I'm certainly guilty of that. Like I'm used to doing this and this way. And if I can't do it, I don't want to do it at all. Well, the problem with that, and by the way, I'm like that. The problem with that is that it's actually not helpful to us. It's not helpful to our mood. Like it's not helpful to us feeling a sense of achievement and mastery and growth and sort of this like acceptance. Like I was talking the other day about how I was never a marathon runner, but I used to be able to at least jog a few miles, right? But like now I'm on the treadmill with my like busted kneecap, like going, 2 miles an hour when I used to be able to, jog, 3 to 5 miles or more in that same time period. And like just kind of accepting, well, but what I need to do is move, like, and stay healthy and feel like I'm taking care of my body. And those things make me, even though it's not the same, so I'll come back to that some more, but and that's hard. And it is okay to vacillate and change between being stubborn one day and saying, I don't want to think about any other way to do it. I just want to be mad that I can't do it. And then having days where you're like, well, maybe doing it differently or something different that might get at it might be okay. Maybe I'll try that. It is okay. So I don't tell you you have to like go straight to the like, what can I do now that will make it better? It's okay to be angry that you can't do it. I just would argue that if every day you wake up angry that you can't do it and don't ever try to start moving towards what else I can do, that will really increase the depression and will not give you good quality of life. So now we're kind of on to treatments. I'm going to spend most of my time talking about things that are related to individual therapy. And by the way, so everything I talk about related to individual therapy, most of those things are also coping things you can do as self-management. So I sort of combined those. So we have got antidepressants, individual therapy, family therapy, because as I said, everything changes for the family too, group therapy or support groups. And sometimes a combination of these things really can be best. Just like with your MS, it's often not managed by taking one medication, by doing one intervention. You might be doing some physical therapy. You might be taking symptomatic meds, disease modifying therapy meds. Depression is not unlike that you might need a couple of things for it to work well. And I'm not going to spend a lot of time on it as I'm not a psychiatrist, so I'm not going to spend a lot of time on those. But what I did want to say about antidepressants, and this is a complex chart where really the most important things are sort of the right-hand column where you're likely to see if you've been on antidepressants, one of the ones that you've been on before. They all work in different ways is the important thing. And so if you've been on an antidepressant that hasn't worked for you, sometimes switching the class of antidepressants that you were on will produce a better result. And so knowing what depression symptoms that are most troubling to you can often help us then pinpoint. This is why those assessments are so important. So just as an example, for people who are having neuropathic pain and depression, things like Effexor and Cymbalta are helpful because they actually also attack neuropathic pain and are approved for those things. Whereas if you need to sleep and you're not sleeping well, something like trazodone or Remeron, the generic name, metazapine, are both really, those tend to help kick sleep in. If you need to be more active, if you're having a hard time getting out of bed in the morning, something like bupropion, Wellbutrin, is going to be more helpful. If you have depression and anxiety together, the whole first group, the Celexa, Zoloft, Paxil, all of those are approved both for depression and anxiety. So what I would say is The better we can target your symptoms, the more likely you are to have success with antidepressants. And so when I'm talking, before I go talk to a doctor, when I've met with a patient, I'll say, you know, if you can wake up and have a few things different related to your depression, what would they be? And if someone tells me I'd be able to go to sleep at night and not spend 3 hours like trying to fall asleep, that leads me to talk to the doctor in a different way than if they say I'm having really bad anxiety with my depression and I'd love that to be gone. So being able to target, these are not all the same and they target different aspects of MS differently. So dealing with loss, as I mentioned, and as people have pointed out, thank you in the audience for pointing them out, is that there's all kinds of loss. And so in therapy, being able to work on loss, and I would say this is one, like some of these things are more self-management, some are more individual therapy. Dealing with loss is more of an individual therapy thing where you're able to really talk with someone, experience the grief reactions to that, the anger, all of the things that you may have in response to loss, and really try to work through those. And again, working through doesn't mean you let go of the loss. Working through means you find ways to live with the loss. It's not that you forget it's there. There will always be losses. In the same way, we can lose a family member and learn to move forward. It doesn't mean we forget the family member. So the losses that come with MS, they don't go away either, but you can learn to still have a good life with those losses. But you have to process this grief first. And that's really, if you're having that kind of experience for yourself and you aren't in individual therapy, I would strongly encourage getting some individual therapy, because what we don't want people to do is get stuck there. The longer you end up stuck, the harder it is to treat over time. And so I mentioned tracking your mood. So I do this with patients, but you can all, again, so a lot of these are, you could do this on your own. You could do this in therapy. For me to really understand my patients, I have them do mood tracking. So in absence of taking a depression assessment, you can go ahead and fill out a mood chart. These are available online and they're easy to find. And you can see that not only does this one, I like this one because not only do you track mood, but you can also track how much sleep you got. Did you take your medications or not? Did you use alcohol or drugs? Did you exercise? And the reason why I like this is because I can often start to tell, if I look at about a month's worth of these, when you have low mood and when you have high mood, and say, like, I notice every day that you get less than 3 hours of sleep, you have lower mood. And so I'm wondering what we need to do about your sleep so that we can do this. Or I notice on the days that the 2 days a week that you exercise, your mood is always higher. I'm wondering what conclusions we could draw on how we could do this. So this helps you start connect the things that drive your mood up and down. And this can be very helpful because a lot of these things really do affect mood. And you can also see document again of stressors, because stressors are going to impact mood, as we talked about earlier. I feel like my slides are skipping over. Yeah. So behavioral activation is simply an idea about this is about being more active in ways that are positive. And so this is sort of a little acronym called ABC Please, which has to do with this idea of trying throughout your day or week to accumulate positive experiences. We'll talk about some of those are. Building mastery simply means being good at something. It may not be the thing you were good at one point. It may be different. Most of us over time, some of the things we were good at, we might not be as good at anymore, but feeling good at something is important. Coping ahead, meaning planning for when you might need to cope, and putting a plan into place for when you know it's going to be a difficult time. Treating physical illness, not letting it go on and on when you know you're having symptoms. Taking care of your eating, avoiding mood altering drugs, balancing sleep, and getting exercise. So this is sort of the combination, sort of if you're looking at depression, most of us will find some of these things that we may not be doing as well as we could. And what I don't want people to do is feel overwhelmed. What I want people to do is they're hearing some of these coping strategies, Some of these you'll look at and you might roll your eyes at me and be like, that's not going to do a thing for me. And you know what? That's okay. I want you to pay attention to the one that you're like, oh, I really have wanted to do more of that and I haven't been trying. And make a commitment to that one at a time. It doesn't have to be all these things. One thing you'd like to do better really can start to make a chain reaction of difference. I don't know why these are all double skipping, but they are. Using more adaptive coping skills. So again, taking a look, we all have positive, we all have negative coping skills. But again, if you were to kind of give yourself a rating on these, on your positive ones, like how well am I using these? Accepting that I can just be mediocre at something and still do it and enjoy it. That knowing that ultimately I have to be responsible for the things I change, utilizing the people who want to support me, versus the negative ones about self-blame, perfectionism. I find that's one of the things that people get stuck in. And so when you mentioned earlier, and I told you about like hopelessness, like learned helplessness is kind of that same flavor of that, of just sort of feeling like I can't make any change, so why bother? And so if you were to look at all these, um, and try to look at the positive ones, and are there ones that you could be doing or do pretty well, but you could do better? And are there negative, and the negative ones, it's not about stopping them. It's about trying to figure out, how do I reduce those? How do I work through those? And that you can do some of that on your own. I think some of that is best for with therapy, because it really is hard changing coping styles that we've done for decades, right? So perfectionists, people who have to do everything right. And let me tell you, when you have MS, there's just no way you can do everything right. And so if you have a perfectionistic personality style, learning to let go of that and learning to like make mistakes, like my slide on disease modifying therapists, I'm like, I don't know, that's a mistake, but it's kind of funny. So I'm just going to like, let it go. Like, why didn't I read my slides better before? Well, you know what? You had a lot going on, Lara, this week. It's okay. Like, we'll all live with disease modifying therapists. I might even use it again. So thinking through these ones that really might be getting in your way is important. And my favorite slide on coping that I make is this idea of, do you have well-rounded coping skills, or are you relying too much on one? So some coping methods are not only better than others, but several is better than just relying on one or two. So just like a balanced meal is better than that giant plate of fries. Now, every once in a while, you can have a giant plate of fries, right? And every once in a while, if you want to just do nothing and sit around in your pajamas and not get out of bed and watch movies all day, and like that's your way of coping that day, that's fine. If sitting in bed in your pajamas watching movies all day is your only way of coping, we've got a problem, right? You can't do that day after day and be emotionally well. And so sort of thinking about your own coping, and are you relying too much on any one thing, or are you working towards having some that are physical, some that are social, some that are just in activities that make you feel good about yourself, and working towards a more balanced plate. And thinking about, how am I thinking about things? Am I always going to the worst? Or when something positive happens, do I argue it away? He just sent me flowers because he feels sorry for me. He didn't really like me. So what are you doing with your thinking? Or overgeneralizing, thinking everything's wrong when only one thing's gone wrong, which I see a lot of people do. I forgot to take my medicine today. See, I can't take care of myself at all. Like, I can't be independent. Like, and that's not true. Like, you forgot to take your medicine today. That's what it means. That's all it means. And so how do I do better from there? And so if I were to ask you to do anything about your thinking, my two favorite questions are, is the thinking accurate and is it helpful? So start with accurate, So So I forgot to take my medicines today. See, I can't take care of myself at all. Well, I forgot to take my medicines today is accurate. I can't take care of myself at all is not accurate. Uh, and then the other question is it helpful? Is it helpful for me to say those things? Because even things that might be accurate, if they're not helpful, trying to find ways of thinking that are both accurate and helpful, are important. And so being able to ask yourselves those questions when you're starting to feel depressed and catch yourself on a train of negative thinking, being able to just stop it and really look at the accuracy and the helpfulness, because both are important. Because sometimes it's accurate, but it's just not helpful. And if it's not helpful, you don't need to be doing it either. You need to find another way. And that sometimes you need therapy for because it's hard. So activity planning, again, one of the biggest changes for people with more severe MS is that, again, brain likes predictability. And if your scheduling has stopped because you've stopped working, you may not be having a scheduled day. I'm working on this with a patient with MS right now who went on long-term disability, and she's just starting to putting things into her day. Now, the idea isn't to put tons of things into her day. The idea is to put some predictable things into her day so that that she tries to wake up within the same couple hour time period, that she takes care of her personal hygiene and eats breakfast every day, and that she has an enjoyable activity, or interact socially in some way, even for 5 minutes. So the idea is creating a new kind of schedule for you that your brain will know is coming. It will help keep you oriented to things, which is good for cognitive, and your brain likes predictability and your body likes it. And so considering creating a new kind of schedule, not like mine where this is my 9th meeting today. You don't need to have a 9 meeting day to have an activity schedule. You just need to have some predictability so that your body can get into a predictable rhythm, your brain can, and you're doing things that feel fun. And there's all kinds of things that can feel fun. I know we're getting close to time, so I don't want to take a ton of time on this. But when people tell me they can't have fun, there are always things you can do to have fun. I don't care how little money. I don't care whether you have someone to do it with. There is always something. And making a commitment, even when it's small. And I can remember when I got out of the hospital, one of my most pleasurable activities when I couldn't get out of bed after major surgery was just petting my dog and just feeling my dog's breath and getting kisses and feeling the fur. And that was literally all I could do, but that's what I focused on, was sort of the enjoyment from that and saying, okay, I can get through the next few hours just kind of doing that. And so it is important. And one of the things I'd say is whatever brought you joy before, you might need to change up the menu a little bit, but there is a vast menu out there. The menu keeps going, things about the house, things around the home. And then the other piece of this is practicing acceptance. And that's not giving in and saying it's just going to be the way it is. In fact, that kind of acceptance isn't associated with good emotional or physical health outcomes. That happened again. Yeah. Practicing acceptance has to do with, I know things have changed and they're different, and I'm going to work through it. And I might have to move through this with changes in my body, but that I still deserve to have a good life, and that I'm going to try to put things in my life that make it good. That's a way of acceptance also. Practicing gratitude every day, trying to think of things, so for me, this is me with my partner, me with my puppy. I like to grow flowers. And those are really simple things that I can focus on. And my flowers are perennials. They grow back every year. So I just see them in my yard and I go cut them and put them in a vase where I can see them and enjoy them. And so really focusing on being grateful for things and creating, you can see what a lot of this is about, is trying to create more positivity in your life, but also just more balance. So it's not about saying everything is great when everything feels crappy. It's about saying I can put positive things into my life even when it feels crappy. that I deserve to put positive things into my life. And staying connected to people. So social connection, people with good relationships live longer, they're happier, they're more physically healthy. Loneliness is a killer. Even if you're an introvert, loneliness is a killer. So finding new ways to interact with people, as we've all had to do like now during COVID, is really, again, staying connected to people. And this is sort of an example of a social support network and trying to like map out like who are those people. And during difficult times in my own life, sometimes it's been not those inner people, but sometimes it's been the outer people. I remember my hairdresser taking me out for a drink after my divorce. She was like, don't go home tonight. Let's have a cocktail. Let's laugh. Let's tell some stories and jokes, you know. And she didn't become my best friend, but in that moment, it mattered to have that person there for me. So thinking outside the box about who's in your life, who you can sit and talk to even for 5 or 10 minutes. It doesn't have to be always sort of your best friend who might be busy that day or have other things to take care of. It can be acquaintances. It can be support networks online. And so also support groups, really important. I hope some of you are participating, if not all of you, in MS support groups. They're really important, whether it's group therapy or support groups. And now that most are online, even easier to participate in. But knowing other people in the same boat as you is important. Getting multiple perspectives. I found that seeing how other people overcome similar challenges is one of the most important things, because when people get stuck in that mindset of like, everything's really bad right now and it can't be better, if I interact with other people and they might even have it worse, but somehow they've managed to start to put things back together, sometimes it inspires me to say, well, maybe my mind has been too narrow. Maybe I need to think a little more broadly because this person has managed to do it in even worse circumstances. So sometimes that perspective sharing is really great. And you learn things that you didn't know, other support information. And if you're more of an introvert, you don't always have to be in the spotlight. You can practice social skills with other people. So I really like support groups because of the change. Usually, if people become more progressive over time, it may be harder to do social contact. So I really like support groups. And I know the MS Foundation does a great job with those things. And so kind of in tying it out as our time has drawn to an end, sort of thinking about sort of happiness is like a butterfly. The more you chase it, the more it will elude you. But if you turn your attention to other things, often it will come and sit softly on your shoulder. And that's kind of the acceptance and mindfulness piece of this, is that when you try too hard to achieve happiness, it's actually harder to get. When you sort of put the good, positive things into place that you know are good for you, little bits here and there over time, they will start to add up. And one day you might be like, you know what? This is not easy, but I'm feeling pretty content with the things I have in my life. When you try too hard to make life look like it did before, because that was your definition of happiness, that's going to cause a lot of disappointment in life.
Wow.
And so I say the grand essentials of happiness are something to do, something to love, and something to hope for. And if you work on having a little bit of each of those in your life, you will be really working towards preventing depression becoming something that takes over while you are trying to manage your MS. So I'm sorry I went over a little bit. It's always hard to get through in an hour, and I'm happy to stay and take questions. I'm not in any rush.
Thank you. Thank you. That was wonderful, Dr. Stepleman. Okay, so we do have a couple messages in chat already, but let's at least give directions to people who might not know how to start doing that. So now we are ready for questions. If you have a question or a comment, you can raise the hand feature in the app or send your question via chat. To raise your hand, you click the screen and you pull up the menu. You select more, which is the icon with the 3 dots, and you click raise hand. I'll unmute you, and then a button will appear on your screen asking if you want to allow me to do that. And of course you will Kimberly would like to know if there's any way that she can get, or if everyone can get a copy of the sheets that you had.
I will be very happy to, I can send both the PowerPoint and make it available, and I can send some of the worksheets down. So that might
Okay.
take me a few days, but I can definitely do that.
Okay, so what I would tell everyone that's participating today, if you would like a copy of that, just respond to the email that we sent you when you registered, and we'll make sure that you get that. Okay. Let's see. Do we have any other chats coming in? Or is anybody raising their hand? Let's see. Nope. Okay. And I don't, oh, we have a lot of thank yous coming in. Let's see. Nope. I don't think, I guess.
Oh, there we go. So let me see if there's any. I'm seeing some questions right now.
Okay.
All right.
Oh,
yes, I see. Yes, my therapist would say
Yeah.
I was masturbating and shitting on myself. Yes, that's a therapy language for telling yourself what you must be doing and should be doing. That we talk about. I don't use that language, but it's cute language for remembering. Someone asked, if you start on meds, can you get off? Or is it once on, always on? So I would say that it depends on the severity of the depression and how good a response you've gotten to your antidepressants over time, how much you are using other techniques that suffice as well. So usually sort of the better that you're coping and the more good coping skills you're building into your life. And if you are getting good response from that, you can talk with your doctors if you're having, because I know antidepressants can cause side effects related to weight gain and sexual dysfunction and all kinds of things that we don't want. So it is possible. So I always tell people it is possible that the best place for you to be may be on those medications, but it is okay if you've built up a good set of coping skills and are doing okay to ask for a reduction slowly and to track with a mood tracker what's happening, seeing if you're feeling worse, if not, continuing on that path, but also accepting the fact that your body and your life will change. That might be okay. At one point, you might then hit menopause, and then suddenly now you have additional dysregulation in your body. And so yes, so I think you can come off them, but I also think you need to be prepared and accepted that life continues to throw us things, and we shouldn't consider it once off, or once on, always on. This is something we can experiment with as long as our mood is holding.
Dr. Stepleman, Judy wants to know, she wants you to know that her, and I don't know if you have an opinion on this, but her MS neurologist and another, her friends with MS told her not to take J&J COVID vaccine. Do you have any opinion on that?
So nope, not a physician. And I have patients who have been asking those same questions. It's really important that you both hear your neurologist out and then also read with, and from what I've read, because when my patient asked about it, I went on, and it wasn't the J&J one, but it was just, should I get vaccinated in general? And I went on, so MS organizations are putting out pretty good literature about that right now. And so I would say count on your neurologist and the nationally known legitimate MS organizations that are offering thoughts on that are usually gathered from a variety of physicians to sort of work towards making that decision.
Okay. And Jacqueline would like to know if you have any thoughts on how she can deal with anxiety before her radiation and her chemo.
Right, back to that. So yeah, so I think part of dealing with dealing with the anxiety of something that's about to happen is different than dealing with the anxiety of something already happening. So it's anticipatory anxiety. So in anticipatory anxiety, so one is to focus on behavioral centering kinds of techniques that will, so anxiety revs your body up, speeds it up, heart rate, muscle tension. So thinking about doing things that will decrease those things. So it turns out like if you actually put into place lots of relaxing things, you almost force your body into relaxation. You know, I challenge you to get a really good massage and do some deep breathing and feel as anxious as you did before. You know, it might come back up, but you are actually undoing all of the physical experiences when you go into periods of relaxation. So today I had a really like big thing at work. And so I got up at 5:30 in the morning and I did some modified yoga because I wanted to be centered. I wanted to not be anxious. 30 minutes before the big thing, I blocked that off from having any meetings. I had 9 meetings today, so finding 30 minutes to block off was not easy, right? And I like worked in a time period to get centered, to rehearse, to remind myself I could do this. By the way, I also had a friend who knew I was about to undergo that thing, and a half an hour before, she also started sending me message after message. You got this, girl. You can do this. Like, you know, you deserve this, blah, blah, blah. I was asking for like a big position change with salary and like a big thing I've been trying to do for 5 years that I haven't been able to do, and finally like got someone to sit down and listen to me. But you know, if you've been waiting for 5 years, you're absolutely terrified, right? So, you know, centering in the morning, rehearsing, and so putting into place preparatory things that are related to that. I think if you don't have a therapist, having someone to talk through to it is really important. Having a support group is really important, and asking other people how they got through it. For really significant this is one of those times where being on medication may also be appropriate if your anxiety, sometimes you need it for a little while just to get it back in control, as long as you're doing something to work on it so you don't have to stay on anxiety meds. When I was diagnosed with my myasthenia gravis and about to, and that involved having to have my chest cut open to remove my thymus gland to try to stop my body from going crazy. I was 35. Nobody wants their sternum cut open at 35. Like that's, that was the first time I realized my body was going to betray me during life. And I was running around like an anxious mess every time, like I couldn't lift my arm or do what I'd be like on the phone with my doctor. My neurologist at one point finally just handed me an anti-anxiety med. And she says, I would do this for anybody. And I'm doing this for you. And I'm telling you, until you're through the surgery, you just need to do this for yourself. And I did, along with other stuff. And when it was over, I didn't use them anymore. But like, it is okay, especially when it gets out of control, to try to attack it in different ways, and finding a doctor that supports you. And many doctors will support anti-anxiety meds when they understand you say, I just like with pain meds, I may not need this long term, but I need this right now. But I'm also going to go to therapy. I'm also going to do some modified yoga or do some meditation. So I want all, but I'm so anxious right now. What I need is to know I have all the tools in my toolbox, because just knowing I have all the tools will reduce my anxiety. And asking
Wonderful.
your doctor to partner with you on that.
Thank you. We do have one more. Casey would like to know, can people be depressed without feeling sad or hopeless, just unable to motivate and uninterested in normal activities?
Yes, so absolutely. So sometimes people describe depression not as feeling down, but as feeling nothing. And this sort of sense of like loss of joy. And again, I don't use a lot of happiness thing. Like to me, happiness is an emotion. It's not a state of being. So when people say, I just want to be happy, I'm like, nobody's happy all the time. Be glad when you have happiness, but we're really searching more towards contentment that operates in a range from like some days are harder than others, but like trying to get there. And so to me, when you're not able to experience any kind of joy, even under things even if it's not depression, but it's sort of lack of joy and lack of feeling like yourself. That's often what people will talk about, is like, yeah, things that really, like, I just kind of don't care. So that can be a sign. And so it's important that if you start to feel that way day after day, even if you wouldn't describe it as, because, and I also think people just think of depression as being much more sort of crying and things like that. And some people aren't emotional people. And so I would say that any change that you notice and how you feel things is important to take note of and to start keeping track of and talking about, especially if you notice you have some of the other signs of depression, even if it's not depressed mood.
Great. Thank you very much. And that's all the time we have for now. If you missed any part of this conference, it will be replayed on msfocusradio.org and available on demand on our MS Focus SoundCloud page or our YouTube page. Remember to follow MS Focus on Facebook, Twitter, and Instagram for times and access information. Our next teleconference is going to be this coming Sunday, March 14th at 3:00 p.m. Eastern Time with Megan Weigel and Luc Renaud, and they're going to be presenting music and movement for mental health. Thank you to Genentech, Bristol Myers Squibb, Sanofi Genzyme, Biogen, EMD Serono, Novartis, Viatris, and Ocrevus for their support again, and to all of our attendees for your participation. A very, very special thank you to Dr. Stepleman for the time you spent to prepare and share this great information, and to go overtime tonight with us was wonderful. Thank you. Goodbye, everyone, and we hope to see you again soon. Bye.
Have a great night.